27 foods that are good for kidneys. Welcome to the Healthy Living channel. On this channel, you will find videos that will help you to achieve healthy living. Relax and watch to improve your knowledge and live healthy. If you are new here, please consider subscribing to our channel and press the notification button so you can be notified when we upload new videos. Thank you. This video discusses kidney disease and 27 foods that are good for your kidneys. These foods are kidney-friendly foods. Now, let us start. Kidneys are small but powerful bean-shaped organs that perform many important functions. They are responsible for filtering waste products, releasing hormones that regulate blood pressure, balancing fluids in the body, producing urine, and many other essential tasks. There are various ways in which these vital organs can become damaged. A kidney isn't the first thing on our priority list when it comes to eating healthy. But, you can enhance the performance of your kidney by eating foods and taking diets which can ensure healthy kidney. There are certain foods that can enhance the performance of your kidney, thereby improving your health. They are simple and everyday foods that are easily available within the household. Inclusion of these foods in your diet would serve as a preventive measure for avoiding contraction of kidney disease. Macrobiotic health experts have emphasized that sodium intake should be avoided as much as possible. Salt intake should be limited in the diet. Less processed items should be taken daily because they contain high level of sodium and trans fats. Moreover, unhealthy kidneys will not be able to filter out phosphorus, hence, lesser quantities of this mineral are recommended for a kidney-healthy diet. Diabetes and high blood pressure are the most common risk factors for kidney disease. However, obesity, smoking, genetics, gender, and age can also increase the risk. Uncontrolled blood sugar and high blood pressure can also cause damage to blood vessels in the kidneys and reduce their ability to function properly. When the kidneys aren't working properly, waste builds up in the blood, including waste products from food. It is, therefore, necessary for people with kidney disease to follow a special diet. Diet and kidney disease. Dietary restrictions vary depending on the level of kidney damage. For example, people in the early stages of kidney disease have different restrictions than those with kidney failure, also known as end-stage renal disease. If you have kidney disease, your doctor or healthcare provider will determine the best diet for your needs. For most people with advanced kidney disease, it's important to follow a kidney-friendly diet that helps to reduce the amount of waste in the blood. This diet is often referred to as a renal diet. Renal diet helps to boost kidney function and prevent further damage to kidneys. While dietary restrictions vary, it's commonly recommended that all people with kidney disease restrict the following nutrients. 1. Sodium. Sodium is found in many foods and a major component of table salt. Damaged kidneys can't filter out excess sodium, thereby causing high or increased blood level. It's often recommended to limit sodium to less than 2000 milligrams per day. 2. Potassium. Potassium plays major roles in the body, but those with kidney disease need to limit potassium to avoid high blood levels. It's usually recommended to limit potassium to less than 2000 milligrams per day. 3. Phosphorus. Damaged kidneys can't remove excess phosphorus, which is a mineral in many foods. Excess phosphorus can cause damage to the body. Hence, a person suffering from kidney disease should avoid having excessive dietary phosphorus in their body. 4. Protein. Protein is another nutrient that people with kidney disease may need to limit because damaged kidneys can't clear out waste products from protein metabolism. Each person with kidney disease is different, hence, It is important to talk to your doctor or healthcare provider about your individual dietary needs. This is necessary because those with end-stage renal disease have greater protein needs. Hence, those with end-stage renal disease may undergo dialysis, which is a treatment that filters and cleans the blood. Generally, those who suffer from kidney disease should eat foods which are low in phosphorus, potassium, and sodium. Here are 27 foods that are good for your kidneys. 1. Apples. Apples are a good source of pectin, a soluble fiber that can lower cholesterol and glucose levels. The healthiest anytime snack that keeps doctors away, apples are also helpful in protecting kidneys. The high pectin content in apples helps reduce the risk factors associated with kidney damage. And don't forget the peel. It is a significant source of antioxidants, including one called quercetin, which is thought to protect brain cells. Fresh apples are also a good source of vitamin C for a tasty treat. Sprinkle apples with cinnamon. 2. Cauliflower. Cauliflower is a nutritious vegetable that's a good source of many nutrients, including vitamin C, vitamin K, and the B vitamin folate. It's also full of anti-inflammatory compounds like indoles and is an excellent source of fiber. Mashed cauliflower can also be used in place of potatoes for a low-potassium side dish. 3. Blueberries. Blueberries are a great source of antioxidants and helpful nutrients. There are a number of berries that can be added to the diet to protect kidney health, such as strawberries, blueberries and cranberries. Blueberries are valuable fruits and vegetables with antioxidant power. Blueberries contain high nutrients, including antioxidants. In particular, these sweet berries contain antioxidants called anthocyanins, which may protect against heart disease, certain cancers, cognitive decline, and diabetes. Blueberries are kidney-friendly diets, as they are low in sodium, phosphorus, and potassium. Blueberries are a low-calorie source of fiber and vitamin C. 4. Fish high in omega-3 fatty acids. Omega-3 fatty acids are essential nutrients our body cannot make, so we must get them through the foods we eat. They have many important functions in the body, including controlling blood clotting and building cell membranes in the brain. Omega-3 fatty acids can also reduce the risk of abnormal heartbeats, decrease triglyceride levels and slightly lower blood pressure. They are being looked at for their potential benefits for conditions such as cancer, autoimmune diseases and inflammatory bowel diseases. Salmon is a favorite go-to source of omega-3 fatty acids, but you can also consider mackerel, albacore tuna, herring and sardines. 5. Sea bass. Sea bass is a high-quality protein that contains healthy fats called omega-3s. Omega-3s help to reduce inflammation and the risk of cognitive decline, depression, and anxiety. While all fish are high in phosphorus, sea bass contains lower amounts than other seafood. It is, therefore, important to consume small portions of sea bass to keep your phosphorus levels in check. 6. Strawberries. Strawberries may be small in size, but they are big in benefits. This delicious red fruit is a powerhouse of vitamins, antioxidants and fiber. The fiber and nutrients in strawberries have been associated with heart protection, as well as anti-cancer and anti-inflammation properties. Toss them in a salad or even eat them plain for a healthy treat. 7. Red grapes. Red grapes are delicious and contain a high level of nutrition. They're high in vitamin C and contain antioxidants called flavonoids, which reduce inflammation. Red grapes are also high in resveratrol, which is good for your heart and protect against diabetes and cognitive decline. 8. Egg whites. Although egg yolks are very nutritious, They contain high amounts of phosphorus, making egg whites a better choice for people following a renal diet. Egg whites provide a high quality, which is a kidney-friendly source of protein. Egg whites are also good food for people undergoing dialysis treatment, who have higher protein needs and need to limit phosphorus. 9. Garlic. Garlic is a good source of manganese, vitamin C, and vitamin B6 and contains sulfur compounds that have anti-inflammatory properties. People with kidney problems are advised to limit the amount of sodium in their diet, including added salt. Garlic provides a delicious alternative to salt, thereby adding flavor to dishes and providing nutritional benefits. 10. Buckwheat. Many whole grains tend to be high in phosphorus, but buckwheat is a healthy exception. Buckwheat is highly nutritious, providing a good amount of B vitamins, magnesium, iron, and fiber. It's also a gluten-free grain, thereby making buckwheat a good choice for people with celiac disease or gluten intolerance. 11. Olive oil. Olive oil is a healthy source of fat and phosphorus-free, making it a great option for people with kidney disease. Frequently, people with advanced kidney disease have trouble keeping weight on. Hence, high-calorie foods like olive oil is good for people with kidney disease to ensure they are healthy. The majority of fat in olive oil is a monounsaturated fat called oleic acid, which has anti-inflammatory properties. Monounsaturated fats are stable at high temperatures, thereby making olive oil a healthy choice for cooking. 12. Bulgur. Bulgur is a whole grain wheat product that is a kidney-friendly alternative to other whole grains that are high in phosphorus and potassium. Bulgur is a nutritious grain, and it is a good source of B vitamins, magnesium, iron, and manganese. It's also an excellent source of plant-based protein and full of dietary fiber, which is important for digestive health. 13. Cabbage. Cabbage is low in potassium, phosphorus, and sodium. Cabbage belongs to the cruciferous vegetable family and is loaded with vitamins, minerals, and powerful plant compounds. It's a great source of vitamin K, vitamin C, and many B vitamins. Cabbage also provides insoluble fiber, a type of fiber that keeps your digestive system healthy by promoting regular bowel movements and adding bulk to stool. Cabbage is naturally low in sodium, which makes it a great vegetable to have to prevent kidney disease. It also contains a number of helpful compounds and vitamins for overall well-being. The best way to eat cabbage is to have it lightly cooked so that it retains its health benefits. 14. Skinless chicken. Although a limited protein intake is necessary for some people with kidney issues, providing the body with an adequate amount of high-quality protein is vital for health. Skinless chicken breast contains less phosphorus, potassium, and sodium than skin-on chicken. When shopping for chicken, choose fresh chicken and avoid pre-made roasted chicken, as it contains large amounts of sodium and phosphorus. 15. Bell peppers. Bell peppers contain an impressive amount of nutrients but are low in potassium, unlike many other vegetables. These brightly colored peppers contain the powerful antioxidant vitamin C. In fact, one small red bell pepper, 74 grams, contains 105% of the recommended intake of vitamin C. They are also loaded with vitamin A, an important nutrient for immune function, which is often compromised in people with kidney disease. 16. Onions. Onions are excellent for providing sodium-free flavor to renal diet dishes. Reducing salt intake can be challenging, hence the need to find flavorful salt alternatives. Onions are high in vitamin C, manganese, and B vitamins and contain prebiotic fibers that help keep your digestive system healthy by feeding beneficial gut bacteria. 17. Arugula. Many healthy greens like spinach and kale are high in potassium and difficult to fit into a renal diet. However, arugula is a nutrient-dense green that is low in potassium, making it a good choice for kidney-friendly salads and side dishes. Arugula is a good source of vitamin K and the minerals manganese and calcium, all of which are important for bone health. This nutritious green also contains nitrates, which have been shown to lower blood pressure, an important benefit for those with kidney disease. 18. Kale. Kale is considered a medium potassium food choice and should be limited by people on dialysis and those with a dietary potassium restriction. This glorious green is packed with vitamins A and C, calcium and many other important minerals. Kale is also a good source of carotenoids and flavonoids, which may translate to super eye health and anti-cancer benefits. Kale contains significant sources of vitamin K. People taking blood thinners, such as warfarin, should speak to their healthcare provider before adding to their normal diet any foods high in vitamin K. Its peak season is winter, which makes kale a great choice during a season with fewer fresh veggie choices. 19. Spinach. Spinach is an high potassium food choice. This leafy green vegetable is high in vitamins A, C, K and folate. The beta-carotene found in spinach is important for boosting your immune system health and protecting your vision. It is also a good source of magnesium. Instead of lettuce in your salad, try spinach. You can also easily incorporate spinach into your diet by making a simple side dish of steamed spinach, spiced up with garlic and olive oil. 20. Macadamia nuts. Most nuts are high in phosphorus and not recommended for those following a renal diet. However, macadamia nuts are a delicious option for people with kidney problems. They are much lower in phosphorus than popular nuts like peanuts and almonds. They are also packed with healthy fats, B vitamins, magnesium, copper, iron, and manganese. 21. Citrus fruits. Citrus fruits are a wonderful addition to your diet. If you want to keep your kidney healthy, the more vitamin C the better. Citrus fruits such as oranges, lemons contain this vital vitamin in abundance. Consumption of dilute lemon juice daily can reduce the rate of stone formation in you. 22. Radishes. Radishes are crunchy vegetables that make a healthy addition to a renal diet. This is because they are very low in potassium and phosphorus but high in many other important nutrients. Radishes are a great source of vitamin C and antioxidant that can reduce risk of heart disease and cataracts. In addition, their peppery taste makes a flavorful addition to low-sodium dishes. 23. Sweet potatoes. The number of vitamins and minerals found in sweet potatoes is great for consumption at any time of the day. Their high fiber content further breaks down slowly, making it ideal to reduce weight. These super spuds are packed with beta-carotene and are an excellent source of vitamins A and C. Sweet potatoes are also a good source of vitamin B6 and potassium. You can eat them mashed or even make your own oven-baked fries. 24. Turnips. Turnips are kidney-friendly and make an excellent replacement for vegetables that are higher in potassium like potatoes and winter squash. These root vegetables are loaded with fiber and vitamin C. They are also a decent source of vitamin B6 and manganese. They can be roasted or boiled and mashed for a healthy side dish that works well for a renal diet. 25. Pineapple. Many tropical fruits like oranges, bananas, and kiwis are very high in potassium. Fortunately, pineapple makes a sweet, low-potassium alternative for those with kidneys problems. Pineapple is rich in fiber, manganese, vitamin C, and bromelain, an enzyme that helps reduce inflammation. 26. Cranberries. Cranberries benefit both the urinary tract and kidneys. These tiny, tart fruits contain phytonutrients called A-type proanthocyanidins, which prevent bacteria from sticking to the lining of the urinary tract and bladder, thus preventing infection. This is helpful for those with kidney disease, as they have an increased risk of urinary tract infections. Cranberries can be eaten dried, cooked, fresh, or as a juice. They are very low in potassium, phosphorus, and sodium. 27. Shiitake mushrooms. Shiitake mushrooms are a savory ingredient that can be used as a plant-based meat substitute for those on a renal diet who need to limit protein. They are an excellent source of B vitamins, copper, manganese, and selenium. In addition, they provide a good amount of plant-based protein and dietary fiber. Shiitake mushrooms are lower in potassium than portobello and white button mushrooms, making them a smart choice for those following a renal diet. Conclusion. In this video, we have discussed kidney disease and 27 foods that are good for kidneys. Dietary restrictions vary depending on the type and level of kidney damage, as well as the medical interventions in place, such as medications or dialysis treatment. Before you make changes to your daily diet, consult your doctor, dietitian or other healthcare practitioners to ensure that your diet meets your nutritional and overall needs. Hope you have enjoyed this video. Which of the kidney-friendly foods discussed in this video do you prefer to eat regularly? Please post your answer in the comment section down below. If this video has been helpful and beneficial to you, then give it a thumbs up and share it with your friends. We love to hear from you. Please post your comments and questions in the comment section down below. Thank you for watching the Healthy Living channel videos. Do not forget to subscribe to our channel, the Healthy Living channel. Thank you for watching.